Namaste. Good afternoon, everyone. Thank you, Usha ji, for very nice introduction. Chairperson, Dr. Sandeep Sharma, Co-Chairperson, Dr. Vishwaraj Mashelkar, my fellow speaker, Dr. Ashish Jain. So, as you know my introduction, I am working with Hero MotoCorp as Chief Medical Officer since last 15 years. My presentation will be on how to create a healthy workplace. With my experience and knowledge, I will be sharing how we can create a healthy workplace, how to have good health and wellness policies and programs. In 2019, we participated in Global Healthy Workplace Award. There is an international organization who is conducting every year this award, and they are inviting applications from all over the world, from companies. We also participated in that. So for participation, we saw their criteria for winning this award, in which they are suggesting that we should follow global healthy workplace model of WHO. So we saw all our policies and programs, and we saw that we are doing everything, but it is not in a good framework. So we try to put all our programs and policies related to health and wellness in WHO framework, and then we presented our application to this organization. They selected 3 finalists from all the applications, and 2019 at Melbourne, Hero MotoCorp was declared winner for this award. So what is the WHO healthy workplace model? Dr. Maria Neira said the wealth of business is best founded on the health of the workers. And in 2007, World Health Assembly of the WHO organization endorsed a global plan for action on workers' health. And the committee prepared a global plan for action setting of 5 objectives. First, to devise and implement policy instruments on workers' health, to protect and promote health at the workplace, to promote the performance and access to occupational health services, to provide and communicate evidence for action and practices, and to incorporate workers' health into other policies. There is another framework which in the previous presentation Dr. Jain was sharing from this World Economic Forum. So the definition of WHO healthy workplace is, a healthy workplace is one in which workers and managers collaborate to use a continual improvement process to protect and promote the health, safety and well-being of workers and the sustainability of the workplace by considering the following based on identified needs: health and safety concern in the physical work environment, health, safety and well-being concern in the psychosocial work environment, including organization of work and workplace culture, personal health resources in the workplace, and the ways of participating in the community to improve the health of workers, their families, and members of the community. So this is a very inclusive definition of healthy workplace in which all the stakeholders are involved. So this is the healthy workplace model has been shared by the WHO, and this is available on their website. So first component, the core of the component is ethics and values. So whatever we have programs and policies regarding health and wellness, in which the ethics and values are the most important, because many companies have many documented programs and policies, but honestly they are not implementing that. So we should be honest and most ethical about what we have documented, and we should implement that only. Leadership engagement is one of the most important components, and workers' involvement. So one component measure is physical work environment that includes a good workplace hygiene, good ergonomics, all the compliances related to work environment like dust, fumes, noise levels, chemical levels within the permissible limit, and it should be as low as possible. We can't say that we are having all the levels within the limits. We should try for the LRR as low as reasonable achievable. Also, we should implement this hierarchy of control at the workplace where this elimination, substitution, administrative controls, then PPE, and then the medical surveillance. So to have a healthy work environment, physical environment, we should follow all these components. Then we have to provide personal health resources to employees. Like there are physical health resources, digital health resources, so all kind of new health resources at the workplace we can provide. This can be based on the demography and the choice of employees. Like younger employees wants more digital type of health resources. There are many fitness apps, many online consultation apps and other things. The older people like more physical things. So we have to take care of all the genders, demographies in our physical health resource environment. We should provide opportunity for community health employment to employees. In my organization, we are providing leaves for the community, doing community work. And the psychosocial work environment, this is one of the most important things nowadays that include the mental health and all the policies and programs which promote the psychosocial health of the employees. And this is not one-time thing. We have to follow the PDCA cycle, plan, do, evaluate, improve, mobilize, assemble, assess, and prioritize. So in my organization, we have tried to adopt this model, and we have fitted all the things in this model only. So in this context, WHO model provides a flexible framework adaptable to diverse countries, workplace, and cultures. WHO will already developed practical guidance specific to sectors, enterprises, countries, and cultures, together with WHO collaborators, experts, and stakeholders. And the principles outlined here are based on a systemic review of definitions of healthy workplaces in the global literature, as well as policies and practices for improving workplace health. So why we need a global framework? So as we know that most of the organizations are recognizing that only physical health is not important. We have to create a holistic well-being of the employees. For that, we include mental health and all the psychosocial health policies in that. And to become a global organization, we have to adopt the global policies and best practices. So given the ethical, business, and legal reasons for creating healthy workplaces, a look at the global situation reveals that many, possibly most enterprises, organizations, and governments have not understood the advantage of healthy workplaces, or do not have this knowledge, skill or tools to improve the things. And it is very important, not only to individual workers and their families, but also to the productivity, competitiveness, and sustainability of enterprises, and thus to the national economy of the countries and ultimately to the global economy. So now the focus is on holistic well-being. 15 years back, most of the companies only focusing on physical health and compliances. Slowly the concept of mental health started coming to all the, and then they started providing mental health support to employees through AAP and other programs. But now the focus is on holistic well-being that includes psychosocial health also, and then only we can say that we have a healthy workplace. So for this, organization should address requirements for creating an environment and for instilling a sense of well-being among employees through several programs and policies. And there is a strong connection between health and well-being of their people and their work environment. When people feel valued, respected, and satisfied in their jobs and works in safe, healthy environment, they are more likely to be more productive and committed to their work. Everyone can benefit from a healthy workplace. So now there are talks of ROI. Many companies management asks that you are doing so many activities for workers and their families regarding health and wellness, but what is the ROI? ROI can be easily calculated. There has been many studies which say that if you invest X amount, you are going to get 3 to 4 times. Even in one study, I have seen that they are saying that there is 23 times returns ROI if you are investing something. Johnson & Johnson CEO once said that the investment, the cost of doing this health and wellness initiative is an investment. It is not a cost to organization. A sample health and wellness policy of any organization should describe its commitment to protect and promote employees' health and well-being. And for any policy, we should define aims and objectives. So a sample aims and objectives can be to provide employees access to various wellness resources for maintaining and improving their physical, mental, occupational, spiritual, and psychosocial health, leading to holistic well-being. To protect and promote health of employees for supporting their performance and productivity. To comply with all legal and statutory requirements related to health and wellness of the employees. And to reduce sickness, absenteeism, reduce presenteeism, reduce employees' personal health care costs, reduce organization health care costs, increase productivity and overall profitability of organization, provide healthcare assistance to employees, dependents, and community, and contribute towards making a healthy and fit society. So the last paragraph I read, these all factors are going to going for your return of investment. If all these things we can monitor after our programs, then we will see that definitely there is a good return on investment. And what should be the elements of the policy? So guiding principles of any well-being policy and program should be a combination of organization health and safety policy, local legislations, global best practices in health and wellness, and WHO healthy workplace model. So all these things can be combined for creating a healthy workplace. A organization-wide health and wellness policy incorporating local legislation and universal best practices, considering employees in all occupations and services. So many companies, like I will say some of the manufacturing companies, they only focus on the people who are working in the manufacturing operations. They don't focus on the people who are working in offices and other things. So we should consider all the occupations in the organization, not only the people who are working in the hazardous process. All programs and policies to be based on health risk assessment, identified needs, expectations, and preferences of employees justified by evidence from health and wellness data through various surveys, studies, and health screening and examination data, etc. Wellness policy should also take into consideration of diversity, gender, especially abled employees. Visible commitment and participation from organizational leadership, adequate budgeting for our ongoing programs, and maximum participation of employees. Health and wellness program impact and outcome should be measurable and manageable with a proper review and adopt and implement as per the qualitative and quantitative feedback. Working with the proactive approach and collaborating internally, externally with all relevant interested stakeholders. All wellness programs will be periodically reviewed for effectiveness, continual improvement, and innovations. Employees' participation and suggestion should be encouraged. So, health and wellness programs can be categorized into 3 areas like physical health management, mental health, and psychosocial health. Further, we can classify the physical health into preventive health programs, health protection programs, and health promotion programs. So, preventive health will include occupational health and general health management. Protective health programs will include curative medical emergency management at workplace, treatment and guidance for minor health issues, health and hygiene awareness, immunization, etc. And for health promotion, we should have promotional healthy lifestyle in general, health screening program, fitness program, provide personal health resources, prevention from lifestyle diseases programs, good food, nutrition at the canteen. So, coming to mental health, good mental health is a state of well-being in which a person understands his or her own abilities, can cope with the normal stress of life, can work productively and fruitfully, and is able to make a contribution to his or her community. So this is a definition of good mental health. A mentally healthy workplace is a high functioning, respectful, and productive environment. There is one survey which says that 1 out of 4 people in the world are having mental health issues. And in one survey, almost 50% employees in India suffer from some stress. Coming to psychosocial health programs and policies, so in most of the organization, these are related to HR, but in some policies and welfare programs, medical welfare programs, the occupational health physicians are also involved. And these policies also affect the health of the employees, because if we are not providing any work-life balance, work organization, stress prevention, policies to promote fun at work, fairness and transparency in processes, opportunities of career progressions. So all these things lead through mental stress, and then these things convert into physical things. Like if stress is there, then the employee can have hypertension, diabetes, cardiovascular diseases. So we have to take care of all these things if you want to have a holistic well-being at the workplace. Elimination of psychosocial risk factors, prevention of workplace violence, harassment, implementation of POSH, then providing opportunity for volunteering, communication and awareness session on personal health topics, training about stress management, time management, on-the-job training, high job satisfaction program, work instruction, etc. So these are few of more components for a good well-being policy. Financial assistance policy for like emergency loan, home loan, educational loan, marriage loan, etc. Then there should be fun at the work, celebrations, outbound trainings, etc. Special leave policy for female employees and other especially abled employees, special policies for them also. Medical welfare policy for the family members, good social security insurance coverage, providing safe and healthy food options at the workplace. So these all contribute for a healthy workplace. So I hope I have shared my experiences for creating a good, healthy workplace, and all the organization can adopt these things, because the WHO Healthy Work Plus model is very flexible, and it is it depends on various countries, legislation, everything can be incorporated in that. So thank you for your patient listening.